So when they come into the office, we'll go through a full evaluation, a complete history, and a comprehensive examination. If x-rays are needed, we'll take a full panoramic x-ray and then usually a lateral head x-ray to look at the throat and airway. And we will do digital scanning, or it's digital impressions, which is a camera that scans the teeth to allow us to really see how the upper and lower teeth are related. And then I'll sit down with them and go through a comprehensive consultation just to explain their sleep apnea problem, what some of the consequences of that are, and what the options are for treating it. And we'll talk about oral appliance therapy, how it works, what the probabilities are that this will help them, and help them make a decision about whether or not this is the right option for their situation. Once they've decided, if they decide to go ahead with treatment, then we will send their information off to a dental laboratory that will custom make the appliance for them. And appliances come in many different shapes and sizes and have different mechanisms on it. And we customize treatment to each person's situation based on their history and what we find in the examination. They will come back into the office. We'll place the appliance, we'll adjust it and fine-tune it so it's fitting properly and customized well for them. We'll go through instructions on how to use the appliance and how to care for it. They will see us for a follow-up visit and in about 6 weeks. And during that 6-week period, they will gradually advance the jaw position in the appliance to what we call the sweet spot, where their symptoms are managed effectively. When we see them at that 6-week follow-up visit, then we will update their progress, we'll check their appliance, we'll confirm that they're progressing well, or we will modify the plan if we need to see more improvement. And if things are going well, then we will refer them back for a follow-up sleep test and to confirm whether or not the position that we have them treated in is effective enough. After that, if everything is going well and the testing shows effectiveness, then we'll see them in 6 months for a similar type of follow-up visit, and then yearly thereafter. Those yearly appointments are critical because we want to extend the life of this appliance as long as possible. And we want to make sure that the bite and the jaw and that their function is still ideal throughout the course of treatment.